Welcome to the deep dive. Today, we're getting into something a lot of cat owners worry about, chlamydiosis.
That's right.
We've done the digging through the details to give you, hopefully, a really clear picture of this feline respiratory thing.
Yep. Think of it as the essential info.
Exactly. Your shortcut, we want you to feel well-informed without getting
Yep.
totally bogged down.
Absolutely. We've looked at the source text detailing the basics, and our mission really is to pull out the most crucial bits.
And maybe some surprising parts, too.
Yeah, definitely. So you walk away feeling like, okay, I get feline chlamydiosis now.
All right, let's jump in. First off, what is chlamydiosis in cats, fundamentally?
Okay, so basically it's a chronic respiratory infection,
Chronic, okay.
and it's caused by this specific bacterium, Chlamydophila felis.
Chlamydophila felis, got it. Wasn't it called something else before?
It was, yeah. Well, you might still see the older name sometimes, Chlamydia sitachivar felis. Same bug, just a name change.
Ah, okay. And what's special about this bacterium?
Well, the really key thing is that it's what we call an obligate intracellular organism,
Obligate intracellular, meaning
meaning it has to live inside the cat's cells to replicate. It can't just, multiply on its own out in the open.
like a tiny hijacker then. It needs the cell's machinery?
Exactly like that. It invades the cells
Yeah.
and uses them to make more bacteria.
Okay, so it gets inside the cells. How does that actually cause the cat to get sick?
Right. So its main target is the lining, the epithelium of the respiratory tract.
Upper airways? Lower?
Both, actually, upper and lower. So think nose, throat, and even down into the lungs.
Mm-hmm.
It sets up shop there and can cause this kind of persistent low-level irritation.
Which leads to the symptoms, I guess.
Precisely. Mild respiratory signs usually stem from that local irritation.
Interesting. Does it ever go anywhere else in the body?
It can, yeah. It's been found in the gastrointestinal tract and the reproductive tract, too.
Does it cause problems there?
Generally not clinical disease in cats, no. It seems to just hang out there without causing obvious illness in those spots.
Okay, good to know. So it's mainly a respiratory issue in cats.
Primarily, yes.
Now, if a cat gets exposed, how long until you might see signs? The incubation period.
That's a really interesting point about this one. The incubation is typically around 7 to 10 days.
7 to 10 days. How does that compare to other cat colds?
It's generally longer. Many other common feline respiratory infections, like viral ones, tend to show up faster.
So that longer delay might be a clue.
It could be, yeah, especially if you're trying to figure out what's going on in, say, a shelter outbreak. It's a distinguishing feature.
Right. So speaking of signs, what should an owner actually look out for?
Well, here's the thing. A lot of the time, the infection is actually subclinical.
Subclinical, meaning no signs at all.
Exactly. The cat's infected, carrying the bacteria, but looks perfectly healthy.
That makes it tricky.
It does. And when you do see clinical disease, it's often because there's something else going on, too.
Like a co-infection.
Yeah, precisely. It rarely seems to cause severe disease all by itself. It often teams up with other bugs.
Okay, but when it does cause signs, what are the classic ones?
Historically, you'd look for general upper respiratory signs, sneezing, watery eyes, maybe some coughing, sometimes difficulty breathing, or they might go off their food a bit.
And what about during a vet exam? What might the vet pick up on?
One of the most characteristic findings is conjunctivitis, inflammation of the membranes around the eye.
What does that look like with this specifically?
It often has this sort of granular appearance, and a key pattern is that it might start in just one eye.
Unilateral.
Yes, initially.
Yeah.
But then it usually progresses to affect both eyes. So unilateral becoming bilateral.
Okay, that's a good detail. Any other eye signs?
You might see excessive tearing, that's lacrimation, sensitivity to light, which we call photophobia.
Squinting.
Yeah, and blepharospasm, that sort of squinting or eyelid twitching. The eyes are often a major clue.
And nasal discharge?
Usually pretty mild, if it's there. Not typically the main feature.
What about the lungs? You mentioned it can go lower.
Right. If it causes pneumonitis, inflammation down in the air sacs, the vet might hear crackling sounds, called rales, when listening to the chest.
So conjunctivitis is key, potentially starting in one eye and maybe some mild respiratory stuff.
That's a good summary, yes.
Okay, so who's most at risk? Does it affect all cats equally?
Well, any cat can get it. But clinical disease, the noticeable sickness, tends to be more sporadic in the general pet population.
Sporadic, okay.
However, you can definitely see outbreaks. That's more common where you have lots of cats together.
Ah, shelters and catteries.
Exactly. Those multi-cat environments are higher risk for spread.
But how common is the infection itself, even if it's subclinical?
It's actually thought to be pretty common. Some studies suggest maybe 5 to 10% of the general cat population might be chronically infected.
Wow, 5 to 10%? That's
Yeah.
surprisingly high.
It is, isn't it?
Hmm.
And many of those cats might not look sick, but could potentially shed the bacteria.
Is it found everywhere?
Yep. Worldwide distribution.
Any particular age group more affected?
It's most commonly diagnosed in younger cats, usually those under a year old.
Kids, mostly.
Often, yeah. But again, any age can be affected. Older cats aren't immune.
What makes a cat more likely to get sick from it than the risk factors?
Well, as we mentioned, having other infections at the same time is a big one. Concurrent respiratory pathogens.
The double whammy effect again.
Right. Also, not being vaccinated is a risk factor.
We'll get to vaccines later, I assume.
We will, yeah. And then there's the environmental factor, living in those crowded conditions, like shelters or breeding facilities.
So environment plays a huge role in transmission.
Absolutely. Close contact is how it spreads.
Okay, so let's say a vet suspects chlamydiosis. It sounds like it could look like other things. How do they sort it out?
Diagnosis is definitely key, and you need to differentiate it. Think differential diagnosis.
What else is on that list?
Well, feline viral rhinotracheitis, or FVR,
Yeah.
that usually has a shorter incubation, like 4 to 5 days. And FVR often causes more severe sneezing, maybe ulcers on the cornea, and the conjunctivitis usually hits both eyes faster.
Right. Well,
Feline calicivirus, again, shorter incubation, 3 to 5 days. And that one's often linked with mouth ulcers, ulcerative stomatitis, and potentially more severe pneumonia.
mouth ulcers, interesting. Anything milder?
Yeah, feline reovirus infection, that tends to be a very mild upper respiratory thing, short incubation, short duration, pretty minor usually.
And if it's mainly lung signs?
Then you might think about other bacterial pneumonias like Bordetella bronchoseptica. X-rays can help there. Bordetella often shows up as a more localized density in the lungs.
So lots to rule out. What are the go-to tests to actually confirm Chlamydophila felis?
The preferred method nowadays is the PCR assay.
PCR, looking for the bacterial DNA.
Exactly. It's highly sensitive and specific, usually done on a swab from the conjunctiva, the eye lining.
Okay, PCR is king. Anything else?
A serum antibody test can be useful.
Blood test.
Yeah. Especially in unvaccinated cats. Finding antibodies tells you the cat's immune system has encountered the infection before.
What about looking under a microscope?
You can. Vets used to do conjunctival scrapings, stain them with a special stain called GIMSA, and look for characteristic inclusions inside the cells, little clumps of bacteria.
Visible with standard stains.
No, that's the catch. You need the GIMSA or a similar, not the usual H&E stain.
Okay.
Can you grow it in the lab?
Yes, cell culture is possible from swabs, but PCR is generally faster and more sensitive.
Any clues on routine tests, like a blood count?
You might see a high white blood cell count, a leukocytosis, but it's not specific.
And X-rays.
Really only helpful if you suspect that pneumonitis, the lung involvement.
Okay, so PCR from an eye swab is the main diagnostic tool.
That's the most reliable, yes.
Let's zoom in a bit. What does it actually look like pathologically, on a cellular level?
Well, grossly, meaning what you see without a microscope, you'd see the evidence of that chronic conjunctivitis, maybe eye discharge, perhaps mild rhinitis, and the lungs, if involved.
You might see changes consistent with pneumonitis, but microscopically in the conjunctiva, early on, you get an influx of neutrophils, those first responder immune cells.
Right.
Later, as it becomes more chronic, the cell types shift more towards lymphocytes and plasma cells, more specialized immune cells involved in long-term responses.
And those inclusions you mentioned.
Yes, you can see those characteristic intracytoplasmic inclusions, but again, only with the right special stains. They're the clusters of bacteria inside the cells.
Fascinating. Okay, we know what it is, how it works, how to find it. What about treating it?
Treatment's usually handled on an outpatient basis. The cat goes home.
Good. What does care involve?
Basic nursing care is important. Gently cleaning discharge from the eyes and nose.
Supportive care? Fluids?
Usually not needed unless there are complications or, those other concurrent infections making the cat really sick.
Activity. Should they be isolated?
Yes, definitely quarantine affected cats to stop the spread. Keep them indoors. Usually just their normal diet is fine.
What about educating the owner?
Oh, that's crucial. They need to understand the cause, that it can sometimes be a chronic or recurring issue.
Right.
And the importance of vaccinating any other cats in the house before they get exposed, if possible.
Makes sense. What about medications?
Systemic antibiotics are the core of the treatment.
Which ones?
Tetracycline used to be common, given multiple times a day. Doxycycline is often preferred now.
Why doxy?
It's usually just once a day, which is easier for owners, and it's effective. It's often given for several weeks, maybe 3 to 4 weeks, or even longer,
That long, why?
to really try and clear the organism and, importantly, reduce the chance of it coming back, of recurrence.
Okay. Anything for the eyes directly?
Yes, topical treatment is usually used alongside the systemic antibiotics, typically a tetracycline ophthalmic ointment, applied several times a day.
You mentioned tetracyclines. Any precautions?
Yes, a big one. Tetracyclines, including doxycycline, shouldn't be used in very young kittens, generally under 6 months,
Why not?
because they can bind to calcium and affect the development of their bones and teeth, potentially causing permanent yellow staining of the teeth.
Ah, okay, good to know. So, alternative antibiotics for young kittens if needed.
Yes, the vet would choose something appropriate that doesn't have that effect.
What if it's in a shelter or cattery situation?
That gets complicated. You might need to treat all the cats that have been in contact.
Treat everyone.
Potentially, yes, to control an outbreak, and the treatment might need to be quite prolonged in those settings.
Wow. And follow-up.
Just monitoring the cat during treatment, making sure the signs are improving.
Okay, treatment is antibiotics, potentially long-term, plus eye meds, being careful with kittens. How about prevention? Can we stop it?
Prevention. Well, there are vaccines available.
Right. Do they work well?
They help. Both inactivated, killed, and modified live vaccines exist. But here's the really critical point.
What's that?
The vaccines primarily reduce the severity and duration of the disease if a cat gets infected. They do not reliably prevent infection altogether.
Ah, so a vaccinated cat can still get infected and potentially spread it.
Exactly. That's a common misunderstanding. Vaccination lessens the illness. It doesn't create a perfect shield against infection.
That's a crucial distinction. So who should get vaccinated?
The American Association of Feline Practitioners, the AAFP, classifies it as a non-core vaccine.
Meaning not for every single cat, routinely.
Correct. It's not like the core FVRCP vaccine. But they do recommend it for cats considered at higher risk.
Like the shelter and cattery cats we talked about?
Precisely. Cats in multi-cat households, especially breeding catteries or shelters where the disease is known to be present or exposure risk is high.
What's the typical vaccine schedule for those cats?
For kittens at risk, the first dose is usually given around 9 weeks of age, with a booster 3 to 4 weeks later.
And then boosters needed.
Annual revaccination is generally recommended for at-risk cats, particularly if they live in areas where chlamydiosis is, endemic or common.
Okay, so vaccine helps but doesn't prevent infection. Recommended for high-risk cats.
That sums it up well.
All right, let's try and wrap this up. Key takeaways on feline chlamydiosis.
Okay, so it's a bacterial thing, Chlamydia Felis. Primarily gets the eyes and respiratory system.
Conjunctivitis is a big sign, often starting in one eye.
Yep. It's quite common. Prevalence might be higher than people think, maybe 5–10% chronic infection rate.
Especially an issue in multi-cat places like shelters.
Definitely. Diagnosis usually relies on PCR from an eye swab. Treatment is antibiotics like doxycycline, often for weeks.
And critically, vaccination reduces disease severity but doesn't stop infection cold.
Exactly. That's vital to remember.
So considering all that, especially the subclinical infections and how common it might be, it makes you wonder, doesn't it? What are the bigger picture implications for how we manage cat health overall, especially in those high-density environments like shelters?
That's a really good question to ponder. How do you best control something that can be so widespread yet often hidden? It's definitely food for thought.